Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we are doing this program in this beautiful studio at the Alan B. Levan Innovation Center, a collaborative venture between Broward County and Nova Southeastern University. So we're very glad that you're here. We have a very spectacular, I believe, guest who has many years of involvement in comprehensive brain health issues and multiple other things. And let me introduce you to Dr. James E. Galvin, MD, M.P.H., and he's the director of the Comprehensive Center for Brain Health at the University of Miami Miller School of Medicine. I got it all. How about that? It's all yours, Doctor. Welcome.
Well, thank you very much for having me. I'm delighted to be here.
Well, tell us about the Comprehensive Center for Brain Health, and tell us what the foci is relative to its, I guess, a very comprehensive presentation of health.
Sure. So we created the Comprehensive Center for Brain Health to really address the need to understand how the brain ages and how that affects a person's ability to live their life to the best of their ability. This center has both a research component and does provide clinical care as well. A lot of the conversation we have about people, it revolves around, disease, disability, and death. And we really wanted to change the conversation and talk about health and vitality and capabilities. The Alzheimer Association basically reports that roughly at age 85, about 4 out of 10 older adults will have Alzheimer's or related disorder. But if you think about that and flip it, that means 6 out of 10 people do not. And that's what we're really interested in. What could we find out from these people that could help us design personalized precision medicine-like interventions that would allow people to live to the fullest of their capacity?
It's such a timely thing because, with us coming through this almost year of a pandemic, if you would get to touch on some of that, I'd be most appreciative.
Sure. We're learning more and more about diseases like COVID and what both the immediate effects are and then what potentially some of the longer effects seem to be. What's interesting is that in several people who have unfortunately passed away from COVID, where they've had autopsies, there doesn't seem to be a lot of direct involvement of the virus with neurons, brain cells. But what there is a lot of inflammation and some small vessel or microvascular changes. And so, at least from the neurological perspective, when people had the acute episode of COVID, many people report a sense of fatigue and what they're describing sort of as brain fog, where they just can't concentrate quite as well. And that's likely due to the strong inflammatory response the virus seems to generate. After the acute illness is over, many people will recover and get back to their selves, but there is a percentage of individuals who are called long haulers or long COVID, and they seem to have symptoms that seem to last for a much longer period of time. And again, from the neurological perspective, that's largely fatigue, a lack of energy, and difficulty concentrating. Again, from our best understanding, there's not a lot of direct invasion of the virus in the brain, but the brain requires every system to work at its optimal, to have optimal function. And so if there are small vascular changes and a robust inflammatory response, the brain will feel the effects of that. And we think that that's likely contributing to a lot of the fatigue and continued brain fog that people report. But this is a very active, ongoing field of research. In our lab, we have a grant from the National Institutes of Health to try to better understand the interaction between COVID infection, chronic obstructive pulmonary disease, which is a strong risk factor for having COVID, and both of those seem to be risk factors potentially for future Alzheimer's and related disorders. So we're trying to study the interaction between those three aspects: cognition, COVID, and lung disease. And so we're just beginning this project, but this is really a very active area of research by a lot of labs and is supported very well by the National Institutes of Health.
We, as you probably know, like I said, as a long timer into this area, we have in the South Florida community, but really in the state of Florida, we have the highest percentage of people over the age of 70 of any state in the United States. We have the greatest number of people over the age of 80 of any state in the Union. I would assume, because of the age relationship, that there is a very vital need, not only for the research that you're doing, but there must be a new verve, if that's the correct word, for people to ask, what is going on with me? What is happening to me? And I would assume that somehow within your institute, or the center, as you call it, that there must be a lot of people that come to you that feel they're confused. And do I have Alzheimer's? Am I just neurologically tilted in the wrong direction? Let's talk about that.
Sure. And that's a great point. I mean, our mission, right, is to really better understand how the aging brain works. And once we understand that, we can then design both treatments as well as sort of prevention plans that can result in longer and better lives. And we use a transdisciplinary approach, which means that we have a lot of different people with lots of different specialty backgrounds working together as a team to try to address that. And we think in this sense, we can make a really strong impact on the lives of individuals and families living in South Florida and beyond. As you mentioned, Florida is a place where a lot of people come to retire. And so we have roughly 6.5% of all Medicare beneficiaries. That's number one in the state. When we think about cases of diseases like Alzheimer's, we're approaching 600,000 to 700,000 cases, which puts us number 3 in total cases, but number 1 in per capita cases when you consider the population of Florida to cases. So these are real problems. So people often come to us to try to understand, what's my risk for developing this disease? I noticed that I'm not as sharp as I once was. Does this mean I'm going to develop the disease? And so we've created several different mechanisms to try to help people. So one, on the clinic side, we'll see people who have memory complaints or other cognitive complaints and try to determine, is there a disease? And if there is, what are we going to do about it? We have an executive brain health program, and this is geared for people in their midlife who, want to do everything they can to develop sort of primary prevention plans, right? What can I do to keep my mind as sharp as it is now? And then we have a research project that's called the Healthy Brain Initiative. And the goal of this is longitudinal, which means annual visits, where we're interested in people who have no cognitive complaints, people who have subjective cognitive complaints. That is, they notice they're not as sharp, but there's no obvious objective findings, and people with mild objective findings. And we do a very, very detailed assessment, taking a very holistic approach. Holistic spelt with both an H and a W, because everything that happens below the neck is going to affect what happens above the neck. And so if you look at the brain in isolation, that's not the way the brain works. So we try to look at the person as a whole, their mind, their body, their soul, their spirit, and try to understand what things are they doing well and what things put them at a higher risk. And we try to put this all together both in clinical practice and in our research projects to, again, make a significant impact in the lives of people living in South Florida and beyond.
Mind, body, spirit is what you said.
Right.
And that's really the mantra of what we are all about here. So I offer it to you.
Well, we love collaborating. We have collaborations across the country and all over the world, studying the questions that we're doing. and I appreciate what you just said. Our model of approach is a shared decision-making model, right? And so, the patient, the participant, the family, the clinicians, the researchers, decisions are not made for people, decisions are made with people. And so we really try to put a very patient-centered approach to both our clinical care and our research projects. And I appreciate you saying, you notice that I take a very sort of holistic approach. That comes with wisdom. I would say that I was graced with a good brain where I could acquire a lot of knowledge through my training, but the application of that knowledge really has come with age. And I would say it would inversely proportional to the amount of hair on my head. So that as I've gotten older, I've gotten wiser, and things that I would have just dismissed as being silly ideas, 10 or 15 years ago, I now fully embrace that there really are ways we can build a better brain as we age. There are things that we understand that are risk factors. And like I said, age is a risk factor. 40% of people at age 85 probably have Alzheimer's or related disorder, but that means that 60% do not. And I think now we need to start asking why. And what we're understanding more and more, there are things that we can't control. We can't control age, sex, genes, and that's probably about 60% of the overall risk. But there are a whole host of things that we actually have some control over, and that may explain up to 40% of the risk of neurologic diseases in later life. And this has really changed the way we've approached our research, really thinking about what makes us resilient rather than what makes us vulnerable, because we can work on resilience.
I'm just thinking, like I told you, we've been doing these shows now for 22 years. So, and I'm thinking back to a wonderful physician who was a neurologist, Dr. Murray Todd, who worked for years. He was really the leader to create comprehensive stroke centers. In other words, the first stroke centers in the United States really came out of his head and his colleagues' work, and they got it done. But I remember very clearly asking him a question. Now, this was maybe 8-10 years ago, so I guess my memory is somewhere in there. And I said to him, Dr. Todd, sometimes I can't remember the name. I said it myself. I can't remember the name of a movie, or I can't remember the name of someone who was on the football team. He says, don't worry, just take it easy. He said, 3 minutes, 4 minutes, you'll get it. It'll be there. Nothing's happening. Just let it happen. So I just wonder whether that certification of thought comes into play in some of the work that you do.
Well, absolutely. What we have found, and many other researchers have found, is that memory loss is not a function of aging. What is a function of aging is processing speed. So as we get older, it takes us longer to process information. So it takes you longer to remember a person's name. It takes you longer to solve a math problem. It takes you longer to remember what you had for breakfast yesterday, but it comes back to you on its own. Where it becomes a problem is where you're not learning new information, so it never gets in. If it never gets in, that's a problem. If it's getting in, it just takes you longer to retrieve, that's age. And to be able to differentiate what's due to age versus what's due to underlying disease, if we can separate those out, then we can start to address what puts us at a higher risk for disease. And knowing that about 40% of that risk is modifiable allows us then to take primary, secondary, and tertiary prevention approaches to address this. And the other thing that we've really focused on is the personalized medicine approach, so that one size fits all approaches really fit no one, because each person is different. And so we really need to understand the resilience and vulnerability of each individual. And so we use this to develop sort of precision medicine-like approaches. And that's really the basis behind our comprehensive Center for Brain Health, rather than just being a center for brain health, because we're not just focusing on brain itself, we're trying to understand how everything in the body will affect us. We have found that people who have loss of strength have a higher risk for dementia. People who have changes in their mobility have a higher risk for dementia. People who have COPD have a higher risk of dementia. People who have vitamin D deficiencies have a higher risk of dementia. And so if you're just focusing on the brain health, I think you're looking just through a tiny little window rather than seeing the big picture. And so our comprehensive approach, again, I don't want to repeat myself, but has really focused on trying to understand what makes people resilient, what makes people vulnerable, and how can we change this? And that has opened a host of doors of opportunities to really look at very innovative questions. And we've been fortunate to be funded by the National Institutes of Health to address a lot of these questions.
This program is really driven by questions that have come from our viewers for years. And the two questions that I repetitively have received over the last couple of years, dominantly, and I really think a lot of it has to do with this COVID issue, because people were scared. But one of which is, are there now new medications? Are there elements of research coming forward to do away with the amyloid plaque and things of that nature?
Well, there's very active research developing new molecules that attack a host of targets. So right now in the United States, there are 5 approved medicines for the treatment of Alzheimer's disease. 3 of them are cousins of each other. They work on a neurotransmitter called acetylcholine. These medicines are symptomatic, and what they try to do is help replace a chemical that declines in diseases like Alzheimer's disease. So they don't reverse the problem, they don't cure the problem. What they try to do is slow down some of the symptoms. Another group of medicine, which is only one member, works on an entirely different transmitter in the brain called glutamate. And too much glutamate makes the brain not work very well. So this sort of blocks the bad action of glutamate, and it's called memantine. And so those first 4 medicines I mentioned are symptomatic approaches. They don't change the disease, they don't reverse the disease. They try to stabilize the symptoms for some time, and then decline is less than compared to people who are not on medicine. The newest member of the medicines that were approved was this past year, which is an anti-amyloid medicine. Now, there's a lot of controversy about the approval of this medicine. The data is not bad, but the approval process was a little confusing to people. So it's unclear how effective this medicine is. But at least in one of the studies, it showed a clear effect. In the other study, it didn't. We've recently we publishing a paper where we looked at all of the studies published looking at anti-amyloid therapies, all of them. And when you look at all of them together, they do favor removing amyloid, but the overall effect is still rather small. So there are well over 200 compounds in clinical trials now that are really targeting a number of different molecules and mechanisms. And if I could just one more point, if you could think about the way we treat cancer today, cancer is not treated with a single medicine. It is not treated in a unitary approach. It is a multimodal approach, right? So if you have leukemia, you get a regimen of 4 or 5 medicines that are each designed to attack a different part of the cancer process. Likewise, Alzheimer's is not a monolithic disease. There are lots of things happening. And so we really believe that it's going to be a multimodal approach using medicine, lifestyle, risk reduction, and behavioral change that's going to help us really try to improve brain health. And so it's going to take a team.
Yeah, you mentioned these various items. Where is nutrition in that issue?
Nutrition is a huge factor. When we look at dietary intake, not diets, I'm not talking about dieting, we're talking about nutritional intake. Um, there are a number of platforms that have been studied, and the one that we use in our research is based on something called the MIND diet. So this is a combination of the Mediterranean diet and the DASH diet, which is an antihypertensive diet. And when you combine these together, what you do is you're increasing the amount of whole foods, whole grains, fresh fruits and vegetables, decreasing the amount of processed foods, high salty foods, fatty foods. And so when you do this as an overall pattern, there's evidence to suggest that people who follow these diets have a reduced risk of developing dementia. And if you have Alzheimer's disease, people who follow these diets tend to progress slower than people who are not following those diets. So a huge factor. And if you really, really think about it, it's a lot of common sense. Think about the things doctors have been telling patients forever, to be physically fit, cognitively active, socially engaged, and eat a heart and brain healthy diet. Really good advice. And the fact is that all of those things contribute significantly to making us more resilient against the effects of age and disease.
Also, being in such a warm weather area, uh, the taking of fluids, it seems to be a major issue every time that we visit with people who talk about nutrition. So, am I hearing the same thing from you?
Yeah, keeping yourself hydrated, very important. Again, particularly in warmer climates, but true everywhere. The general recommendation is, if you can get, you know, eight 8 ounce glasses of water a day, that's keeping yourself well hydrated. And in environments, that have high humidity, you may need to replace fluids and electrolytes. And in areas that have low humidity, like Arizona, for example, people become dehydrated very fast without realizing it. So keeping someone's self-hydrated is really critically important. Um, and it's more of a preventive measure. So it's less about keeping yourself healthy as opposed to reducing the risk of serious consequences of becoming dehydrated, which can cause a whole host of medical problems for particularly older adults. So it's critically important. Again, I think we have to look at the body as a whole um, in order to understand how that affects brain health.
Do I? It's come to my attention that you have the Brain Health Center. Is it located in Boca, or where is it located?
So we're physically located in Boca Raton, and we're part of the University of Miami, which actually extends up the coast, representing all three South Florida counties. So the main campus obviously is in Miami and Coral Gables, but we have centers and institutes in Broward and Palm Beach County. Sylvester Cancer Center extends through three counties. Bascom Eye Center extends through three counties, and now the medical practices and research operations extend through the three counties.
I just want to make sure that our viewers have the opportunity to gain access to whatever is available, and if they wish to communicate with the system to be, shall we say, reviewed. And otherwise, I don't want to say examined or otherwise. I think reviewed is a better, simpler term. I think it's a good thing, and I think we ought to do it. Again, I really appreciate you giving your time because this is, as I say, this program has always been driven by questions that come from our viewers, and we have hundreds of thousands of viewers who are going to see this show. And I'm just glad that we finally got to the subject matter because, but what really drove the questioning, and as I said in the beginning, it was, I think there's a lot of aggravation, despair, and otherwise that came from this almost year and a half of this COVID crisis. And, but I think it made people at home start to think about, well, what's the problem here? In other words, and you've answered a very, very important question of many of our viewers, and I appreciate you giving us your time. We're down to the last minute of this show, so I want to say that it's not only that you're a physician, but you're an advocate, and not only are you an advocate, but you're really my mentor, the founder of our programs here, always used to say is that you have to have the privilege of the patient you have to earn the respect of your patients. And I see that in your comments, and I really thank you for your hard work and your, like I said, advocacy. So we know that Dr. James E. Galvin, MD, and I see you have a master's in public health, which I think is a wonderful degree to have if you're a physician. It gives you a little broader concept of what's going on beyond your subspecialty or specialty, and we're very, very pleased. Dr. Galvin is the director of the Comprehensive Center for Brain Health at the University of Miami Miller School of Medicine, and he's located in Boca Raton, and we're going to let you know how to reach him. Thank you very, very much, Dr. Galvin. I hope we get the opportunity to have some collaborative research. We do collaborative research with you and them on a number of items.
Absolutely. So we look forward to it. Thank you so much for having me on the program.
Thank you very much. Ladies and gentlemen, or as I always say, my friends, remember this show, if you want to reach us, there's an address and an email address and a phone number. And remember, we come to you from Nova Southeastern University. Our privilege is having you to watch the program, but more importantly, it's my privilege to be able to bring people here to give you the information. My name is Fred Lipman. We come to you from Nova Southeastern University. Until next time, see you.